So this is a little bit more of a constant learning lecture than one topic. So as opposed to the two great lectures you've already heard today, between Lopez talking about how to safely put those kids down, and please don't do that to your own children later, or how to manage flash pulmonary edema, a lot of new topics, a lot of cutting edge stuff with Eric. This is more of how do you keep learning. So some of this information that you've learned at this conference is probably very new. We have a wide variety of skill sets here, and we understand that most learning isn't taking place at conferences. It's taking place elsewhere, okay? So one of the important things here is how do you keep doing this year-round so that it's not just, oh, there's this one weekend a year, and we hope to see you again next year for this, but how do we keep learning? We're dealing with adult learners that learn in different ways, different styles, and need different teaching methods. So how do we do that without breaking the bank so that we're constantly continuing to improve our practice, not just here this weekend, but all year round. And that's what really excites me. So I have one minor conflict of interest. Sometimes I accidentally make money on educational stuff. I just donate all to charity. I've been contracted to do a lecture for EMRAP, and I'm actually going to discourage you from going out and getting an EMRAP subscription, but I accidentally made money. So let's talk about something called PEM ED. So this is what excites me, and this is a huge revolution that is taking place in medical education. It used to be that people learned by books, and then the people that were really cutting edge, they would go to conferences instead of going to books. And then after a while, people were realizing that they actually learned more talking to other people and then sharing ideas online. And then this started, which is free open access meducation. And I hate the word meducation, so I just say medical education. But it's basically the idea that you share whatever you make to educate people about medicine. You don't charge anything for it. Because as soon as you put a $5 price tag on it or a $200 textbook cost, then you've just excluded a lot of folks, both working folks like y'all that just don't have a lot of CME or any CME, as more and more people are considered independent contractors, or you got medical students, you got people that aren't even in med school yet that are interested, you've got nurses that generally have very low CME accounts, and then you've got the entire rest of the world. So if you're a physician in Africa, there's no way that you can afford a $300 textbook. It's just not happening. That might be 6 months' salary for some of these folks. They can't do it. So if we share it, and it's free, it's online, then it gets out there. And it doesn't if we don't. So this was started over a pint of Guinness in a Dublin pub, which is just fine by me. But the main thing here is you can't charge any money, okay? And this has exploded. It started off mostly as an emergency medicine critical care focused centered activity, but now more and more they're expanding to other things. So anesthesiologists are getting in there, general practitioners, pediatricians, and so forth. But it's still actually mostly emergency medicine and critical care folks. So let's talk about podcasts. So first off, what is a podcast? So it's a combination of the word iPod and broadcast. That they just smash them together, and that's a podcast. So if anybody listens to talk radio, sometimes they're talking about stuff you want to. Sometimes they're talking about things that you don't want to hear about. The beauty of a podcast is that you choose what you want to listen to. Don't want to hear a topic about asthma because you're very, very comfortable with asthma? Great, skip it. Terrified of a neonatal heart condition? Oh, you may want to listen to that congenital heart disease lecture 3 or 4 times because you're just terrified of that TET spell coming in and not knowing what to do. This lets you adapt what you need and not what someone else needs. So basically, you're able to download lectures, and most of these through iTunes are absolutely free. So iTunes, I don't get any money from Apple. I'm a begrudging tech nerd. They have the most popular podcatcher. If you're an Android nut or really hate Apple, you can avoid iTunes. I don't recommend it because almost all podcasts are put out there through iTunes. You can try other things like Stitcher and other apps. It's just a lot trickier, and I wouldn't recommend it, but you can do it. iTunes is what we call a podcatcher, meaning this is how you get those lectures onto your device, be it a laptop, be it an iPhone, be it an Android phone. It works just fine on Android. So how do you find these? At the top left of your iTunes app, you'll see this little button, and you may never have even paid any attention to it. This is the podcast button, okay? If you click on that, you go to the iTunes store, and then you can start searching. And now I'm going to tell you what you should look for that's out there. So this is probably the premier PEM ED podcast, and it's called Epocrates. This is very high-level stuff put out by an ED intensivist named Scott Weingart. His idea is that geography shouldn't determine your care. So if it's a good idea for people in the ICU to have you on a fentanyl drip or something like that while being sedated, then that's probably what should be happening downstairs in the emergency department. So where the patient is physically located should not determine whether it's a good idea medically to do something or not. If it's a good idea for us to give nitroglycerin in the emergency department to someone in flash pulmonary edema, then maybe it's a good idea for us to have that in a pre-hospital setting. Those kind of ideas, that if there's not a compelling reason why you can't do something, you should be doing it, okay? So the problem with this is that your practice setting varies widely about whether or not a lot of the stuff they're talking about on this podcast applies to you. It's very, very high-level stuff. Some of this is not ready for prime time, meaning 10 years from now, we might be doing some of this, but a little bit of it's far-fetched. And it's really exciting to listen to, but it isn't necessarily that thing that you're going to do next shift unless you're taking care of a lot of critically ill folks. However, if your shop is like mine, where you're taking care of a lot of boarded critical ill patients, and you're like, oh, well, it used to be 5 years ago, we never had someone on the vent downstairs for more than an hour or two, and now we have people that stay on a vent for 6 or 7 hours. What am I going to do with these folks? This is a perfect podcast to listen to. ERcast. This is one of my highest recommendations for you guys. This is put out by Rob Orman, great guy. It's very community-oriented. He is not a high-level academic guy. He is a community doc that just got into education, okay? So one of the things that really drives him is, can you physically do this in a real setting? So he's very pragmatic. He doesn't recommend these long, elaborate, you got to mix these 97 drugs together. He's very, very simple, straightforward, can we get this done where I work? Skeptic's Guide to Emergency Medicine. So if you enjoyed my talk yesterday and really, really like reading literature and learning how to read an article skeptically, this is great for you. If you don't, skip this, okay? I love it. I'm putting out a SGM podcast with Ken, but one of the problems with it is this is very statistically heavy. It's very nerdy when talking about the numbers, and if that's just not you, move along, okay? But it is very accessible. So if you want to know what people are talking about when they're talking about different statistical tests, or what it means to be statistically significant, or why this paper is awesome and this paper is awful, this is where you go. Okay, so it'll teach you the skills without expecting that you have a degree in biostatistics. And it's very rare that you find that. Next up is SMACC conference. This is the single greatest conference, after this one, of course, in the history of medicine. It actually basically is a bunch of people that are spreading FOAMed literature and giving lectures, and it's an international view. So if you want to find out how the Australians or the Europeans are doing something, this is a great place to go. Very, very cutting edge, but surprisingly practical. And then you'd be surprised how often getting a different perspective on what we're talking about is very, very helpful. Every lecture they do that they post is free. And so you actually have more than 1 year's worth of podcasts that are available, literally hundreds of hours worth of material that you can go out and get. The Ultrasound Podcast. So working with a lot of you guys, especially at the workshop yesterday, many of you were really on fire about ultrasound. Maybe you've got it at your shop. Maybe it's something that's coming. It's going to be present in most emergency departments in the future if it's not already where you are. But maybe that ultrasound machine's just sitting in the corner collecting dust, because nobody really knows how to turn it on. It seems scary. Like, I don't know, if I put it on there, what's going to happen? And I promise you nothing bad happens if you just go around scanning folks. I know that you're busy, but you'd be shocked at how little the patient knows when you have no idea what you're scanning. I'm telling you, when I was first doing it, I was like, what is that? And I'm like, oh, things look great, sir. It was great. Like, if that thing, yeah, it's looking good. Don't see anything wrong because I don't see anything. Like, it was amazing. They don't know. And so if you're trying to learn how to do lung ultrasound, and like the first 4 or 5 times you do it, you're like, I don't know what's happening at all. And then it clicks and you see, oh, this guy's wet. Okay, he's got these lung lines. Oh, okay, I got it. Or you do an echo of the heart and I don't know. Oh, look, this thing's really not squeezing so hot. I don't know why. I can't tell you if that's a mitral valve or an aortic dissection. That's okay. Not squeezing good. That's important knowledge, okay? And it can really be that unsophisticated of squeezy good or not squeezy good. Now, these guys will give you the confidence to learn how to do that more. Some of the stuff they do is really weird, okay? I'll warn you. They enjoy like, oh, let's check for scaphoid fractures with ultrasound. And I think that's amazing. Not super practical for most of you, okay? But they also cover really core stuff. How to do a fast exam, okay? How to learn how to do an ultrasound of the heart. How to do lung ultrasound. Really core stuff that you can do today, okay? So I was chatting with someone yesterday, and they were saying, it's just so much quicker for me to ship them off to the ultrasound suite to get their gallbladder scanned. And that may actually be true. Some folks, if you get really good, you can actually pick up enough speed to where you do your own scans, you move the person along, and that's great. And that actually can save you time if you get great at scanning. But at first, it will take you a little bit of extra time. However, there are some things that only we can do, that no one else can do. So you can't get an ultrasonographer to come in and do an echo on someone whose blood pressure is 50/30. Can't do it. They won't get there in time. The person will be dead by the time they get anywhere. Not to mention, the last thing you want to do to a crashing patient is send them off to the bowels of the radiology suites. That's the absolute last thing you want to do. So these guys will teach you how to catch up on that and learn how to be a self-motivated learner and get there on your own. EM Basic, this is the single best podcast that I could recommend to you. It's absolutely fantastic. If you are fairly new to emergency medicine, maybe you didn't do emergency medicine residency, if you're getting back into the game after a few years of doing something else, this is the podcast to go to. Absolutely phenomenal. Now, I will warn you, this is eating your veggies. This is not dessert, okay? He really goes over topics very well, but it's a little dry. But if you want to know how to work up chest pain, how to work up a PE, so forth, this is where you go. And then if you are uncomfortable with kids, the PEM ED podcast is absolutely fantastic. Some of you may not be used to seeing kids that often. Maybe they rarely come into your shop. Maybe you're fortunate enough to be at a shop where most of the kids go to somewhere else, and then occasionally a sick kid comes to you. I think it's really important to have this because it's one of the things we're most uncomfortable with. So these are the 22 that I listen to and follow. You will quickly go down a rabbit hole with these things if you're not careful, but the ones that I highlighted are the best ones that I recommend for you. Okay? I leave this mostly up for the video so you can pause it and find other things. So what about other things like blogs? So not everybody is necessarily preferring to listen to things. Maybe you're more of a reader, and that's okay. So RSS is Rich Site Summary. It basically pushes content to you, so you don't have to constantly check websites and blogs to see if there's an update. The best feeder, much like a podcatcher, is Feedly. Okay, so this is an RSS feeder, meaning that it's going to accumulate all these things. If you go to Feedly, follow directions, it's really simple, and you'll be able to follow blogs. The stuff just gets pushed to you, so you don't have to check it every day. So you just go there, you search. If you just type in emergency medicine, you're going to find stuff. You just add it. It's very much like subscribing to a podcast, and there you go. This is the single best blog in existence. It's called Life in the Fast Lane. It's put together by some Australians, but it's very, very international based. If you just want to know how do I read an EKG, how do I do a certain ultrasound or something like that, it's either on this blog or there's a link to tell you where to get that resource. This is the single best gateway to FOAMed that currently exists. So it basically scoops all the best stuff out every week and then feeds it to you. So if you did nothing else from this lecture, nothing else other than just go to Life in the Fast Lane, you will be a much better doctor. Much, much better doctor. Or nurse practitioner, or PA, or whatever it is that you do. You will be much, much better at it because of Life in the Fast Lane. There's also Academic Life in Emergency Medicine. Very good. It's actually not as academic as you think it is. Very practical. EM Lit of Note, very much like the SGEM. If you want to learn how to read literature in a very skeptical way, this is a great one to do it with. Boring EM, ironically enough, is not very boring, but it is very much EM. It's actually very interesting and engaging, but very community-oriented. We know that we take care of a lot more ankle sprains than flash pulmonary edema patients, but it's really fun to talk about flash pulmonary edema and really boring to talk about ankle sprains. These guys do a great job of presenting that stuff, which is actually most of our workload. Here are the 22 blogs, mostly so that you can have it in the future on the video. What about apps? So Epocrates is a free app. I'm not sure how many of you guys are currently using this. It's free. They get your information. They send you a bunch of emails. It's kind of annoying, but it actually is a pretty good pharmacopoeia to sort of check to see what you're using. And it has a great pill finder. So if you ever have that tox patient come in and you're like, hey, he took a bunch of white pills with B22 on it, you'll be able to find out what that pill is using this app. This is something I mentioned yesterday. It's How I Read My Journals, read by qxmd. And then you can very quickly go down the journal rabbit hole. This takes a lot of time. I recommend against it for most folks. I think that it's much better for you to go to podcasts and blogs to get your information condensed down for you, unless you enjoy reading journals. So what about paid content? Paid content is not FOAMed because you have to pay for it. Sometimes you would think, oh, I'm paying for it, it's got to be better than FOAMed. Not necessarily so. There's a lot of paid-for stuff that's actually not any better and actually a good bit worse. EMWrap is the premier paid podcast. It costs about $400 a year. There's about 4 hours an episode, and it comes out monthly. It's a lot of content considering, and this is another thing. If you really get into podcasts, it's a great thing to deposit some CME into. But again, conflict of interest. UpToDate, very popular, very hit and miss about how good this is, but it's catastrophically expensive. $500 a year for an individual, which is frankly just too much for what they're doing. Now, if you're wanting to, you can get your own license. It's much cheaper if you go in as a group. So sometimes your hospital will get it. The problem with this is the articles vary greatly in quality. Some of them are amazing. Some of them are really, really not up to date at all. And it's really hard to figure out what conflicts there are on some of their articles. EM Abstracts is another good paid-for podcast. They basically condense a lot of articles down. But this is one of the most important lessons from today. You don't get extra credit for spending more time on your education. You don't. No one finds out whether you spent 40 hours last week hitting the books, reading journals, listening to podcasts, unless you apply it to your practice. If it is not working for you, if you're listening to a podcast and it just is not clicking, you just stare off into space and it's not working, stop. Don't do that. Figure out another way to learn this, okay? If you have to read it instead, go do that. That's okay. You don't get special credit. That patient still either has a good or bad outcome based on your care, not whether or not you spent 50 hours last month learning more stuff. So focus on what you're doing. So if you're kind of new to the emergency medicine game, what I really recommend is you go to EM Basic, and then there's one book that is called Baby Tentinelli affectionately because it condenses most of our textbook into a really short form. It's called Just the Facts. This is 90% of the goodness of the huge Tentinelli book at about 20% of the size. So if you just open it up and say, oh, look, let's talk about asthma, most of what a good practitioner will do is listed here. Okay? Sure, there are nuances that they had to cut, but for the most part, this is fantastic. And if you just need an update, like, oh, I haven't really changed my asthma practice in 20 years, wonder if I'm still up to date, you can very, very quickly find out. It's only about $68 on Amazon. Annals of Emergency Medicine is the single journal that I think that most providers ought to at least skim because it's the most important emergency medicine journal. So let's say that you're getting a little bit on up there, you're getting more into these things. What kind of things can you add to that core? I think that adding Life in the Fast Lane and Annals of Emergency Medicine are the main things I would do. And if you have some CNE money, consider emergency medicine wrap. So 80% of the benefit of doing anything comes from 20% of the effort. If you spend 20% more time learning about education, then you will get 80% of the benefit than if you spent all your time doing it. This is very humbling because it means that after a while you're getting diminishing returns. If you're spending 50 or 60 hours a month trying to learn more about emergency medicine, great, but you're only going to be a little bit better than that guy that spends 5 to 10. And I say that not to discourage you because you all have colleagues that you're thinking, oh, I just can't read as much as that guy does. There's no way. She's so smart. I could never catch up to her. You can by just doing a little bit of work. It just takes a little bit and you'll get most of the improvement. But you have to balance your life in medicine. Find out what works for you and abandon the things that don't. Does anyone have any questions?
So we listened to a podcast recently because of the residency, and I encourage everybody to do the podcast. It's great, and the way to do it is just like you're driving. After you download it, you can listen, and it's like 10 minutes, and you get the whole thing. How do you do like arrange? Because I listen to them basic. Phonecast, and it was like it's too much of like every week you get MRAP, you get all those. It's just like how you arrange, prioritize what you should do, what you shouldn't.
And that's a great question. Most people are going to, so he's asking about how do you prioritize the different podcasts and how do you balance that? Because very quickly as you add more and more podcasts, there's only so many hours in the day. So the ways that you get around that is look at what works best for you. A lot of these will be topic based, and if you're good at something, you should probably skip it. Now, that's not a lot of fun because it's great to know everything about status epilepticus and then listen to a lecture on it and be like, yeah, I crushed it. I knew all that already. It feels so good. Versus, especially like PEDS topics, and you're like, oh, I don't know anything about bronchiolitis. Next, let's not do that. It's really uncomfortable to go to those places that you don't want to go to. So think about what scares you the most. Like, what patient is it that you don't want to see come in? Is it that third trimester vaginal bleeder? Is it that 2-week-old that's got hypotension and isn't breathing right? Is it that airway disaster? What is that thing that you most hate? And that's what you should listen to. And that's very uncomfortable because you want to do the opposite. You want to be like, oh, I know everything about trauma lectures. Yeah, like it's so easy to do that. So that's how you should really prioritize and realize that if you're not getting something out of it, you should skip it. And that's how you're going to get the most high yield stuff. So if you're not learning from that particular podcast on that particular topic, it's okay. You can delete it and feel great about yourself because you're doing something. Any other questions at all? I thank you for your time.